Hi, this is Travis here at Exercise Lab with another video for you guys. So I'm a doctor of physical therapy for those of you who don't know me, and posted quite a bit of content on this channel, rehab related issues, new products, old products. Today I want to talk about something that's fairly new, not brand new, but it's been around for a little while, called the MARC Pro. It's a form of electrical stimulation, and for those of you who are familiar with this channel probably can tell, I'm not a huge fan of electrical stimulation. I think most of the time there are other ways to get more bang for your buck, though I do think there are some limited applications for it. This is a little bit of a unique product in that it uses a different waveform, kind of what they call their proprietary waveform. So I'm going to be coming at this product as a little bit of a skeptic. I'll be talking about, can it make good on those claims? And if it can, who's going to be a good candidate for it? We're talking about pro athletes, we're talking about rehab related issues. And so I'll be giving you my 2 cents on the MARC Pro today for those of you who maybe still need a last minute gift. So if you're interested in learning a little bit more about this MARC Pro, go ahead and stay tuned, and we'll get started. All right, so I've already been using this thing for a little while, so I'm not going to do a true unboxing, but I just want to show you guys the case on this thing. Pretty nice, actually. Holds this thing pretty well. It doesn't feel like if I drop this, it's going to break the unit. You open this guy up. You essentially have your electrodes here. It comes with this little booklet, which I'll show you guys. Just kind of has some rough ideas on how you can, put the pads, different parts of the body, different goals in mind. You got your MARC Pro inside of here, which is essentially your unit. It comes with a little, kind of carrying case here as well, in case you don't want to lug this big thing around. 2 different types, or 2 different, essentially, electrodes, which they tend to label A and B on this thing. And so again, that could be if I'm trying to do bilateral or both sides. Sometimes you may want to do just one side, so you can just use, say, A. I'll be primarily just showing with one today. Comes with a little aloe gel. They say this can maybe help a little bit with the applicator shelf life, because one of the drawbacks with any of these types of electrode pads is that they do tend to wear off after a while. So especially if you're going to be using this thing on a fairly regular basis, eventually they just lose their stick. Most of the time they should last hopefully at least about a month or so, maybe longer, but again, it just depends on how often you use it. If you're only using this thing like once a week, you probably can get some pretty good life out of these. So that being said, these are pretty much all the goodies that are included. And so what you want to do is you want to just go ahead and take one of these. Say you plug it into A. The good news is these aren't sided, so you can just kind of shove this thing in here. Obviously don't shove it in, just kind of ease it in if you can. Somehow this thing just turned on, but normally it's going to be off. All you have to do is switch it on, is just like this. On this end here is where you're going to put your pads. And before you know where you want to put your pads, you want to ask yourself, well, why am I using this thing in the first place? Now, according to MARC Pro, they use what they call a proprietary waveform. Essentially what that basically means is they're using a form of stimulation that they claim does not induce fatigue. And the way that they say they're able to do that is because it's a very slow waveform. I want to say it's about 2 hertz. And so they're not getting enough of a muscle contraction to really induce, muscle breakdown and tissue damage. Those micro tears like that induce what we call DOMS, where you get sore, say 72 hours or within 72 hours after a workout. They're saying that they're inducing some stimulation of the muscle that doesn't necessarily break down, and so you're not getting the fatigue, and so you don't necessarily have to recover from this thing. And that would be a pretty clear advantage if those claims are true, which I'll be talking about a little bit later in this video. But if we can take that, on faith for now, and we can say that, okay, this thing does not fatigue me, well, what am I going to use it for in that case then? And so when they talk about a term they call flushing, what they really mean is they're removing, essentially waste products, metabolites that we know are built up essentially when we're, say, doing physical activity or exercise. And so we have this system, which we call your lymphatic system. It's kind of like the circulatory system, but a little different. It's not as directly influenced by, say, the heart, which helps to circulate our blood continuously. The lymphatic system depends a little bit more on muscle contractions to sort of circulate things around. And so if you're somebody who's very sedentary, or maybe even somebody who's bedbound, that lymphatic system can essentially get backlogged, and people can get what they call lymphedema on the extreme end, where they're getting a lot of swelling. But people maybe on a lower level could have some degree of that, or maybe you're not necessarily getting lymphedema, but maybe you're just not getting that flushing effect as readily because you're just not getting those muscle contractions. Or if you're somebody who maybe did a hard workout and you want to just get those things out of that area a little bit quicker, perhaps this thing could speed it up. And so in that sense, you might be able to get a little bit of a benefit by using a product like this, because if you can flush those things out quicker and maybe even bring in some things that facilitate tissue repair, tissue healing, maybe you can get back to that workout a little quicker, or work out a little bit harder during the next workout, which essentially would, snowball into you getting more gains. So in theory, that's how this thing can facilitate performance enhancement, and recovery. So that being said, muscle activation, recovery, those are the main reasons I would use this thing. They have another unit called a MARC Pro Plus. The reason I didn't get that unit is because they say that's a little bit more for pain, similar to a TENS unit. For those of you who are familiar with a TENS unit, I don't want to go on a huge tangent, but basically the idea is with TENS, you're kind of employing something we call the gating mechanism of pain, which is the idea that you're sort of short-circuiting the pain signal. Because say I bump my elbow on a wall, the reason why I'm going to rub it afterwards, or I touch a hot pan, I want to put my fingers in my mouth. Part of the reason we do that is because we're sending extra sensory information, and that information travels a little bit faster, and it kind of beats the pain signal. So that signal of elbow, to brain of, hey, this hurts, I just bumped my elbow, it kind of gets basically cut off a little bit or blunted by the extra signal of, hey, I'm rubbing my elbow now. And so that's why it kind of diminishes that pain signal. That's one of the reasons that TENS units can actually work, is because they're providing extra extra sensory input, essentially, in addition to this pain signal I might be getting from my back or whatever body part is injured. And that's how TENS unit works. But the thing with TENS units, they say, is it's stimulating more of what they call like a tetanic contraction. That, again, obviously depends on the parameters. You don't have to turn it all the way up to tetanus, but if you were to, or even just, at a lower level, TENS units might be able to induce a little more muscle fatigue, whereas they're saying this unit, because it's at a lower hertz, does not induce that muscle fatigue. So I think there may be some theoretical basis for that. Obviously, we need more studies to really see if that's actually the case, but it seems, at least theoretically, that it's possibly true. So if we take that on faith for now, that's where I would use this thing. I would use this thing, say, for instance, somebody that was trying to get to recover a little bit faster, somebody I wanted to maybe get into a workout, more quickly, somebody that maybe couldn't work out for, certain reasons. Maybe I could put them on this, see if I could maybe, get them moving a little bit better, get them moving a little bit more comfortably, and then maybe even get them back sooner to the next workout. And so that's in theory how this thing, again, can facilitate performance enhancement. So all that being said, let's go ahead and talk about where to put these things. So if you're already a physiotherapist or a physical therapist and you're familiar with, estim units, you probably don't need to, get into all this. I would say that if you're not somebody like that, though, and you don't really know a lot about, electrical stimulation devices, this book is actually not too bad. They basically run through some examples of where to put pads, depending on, again, they show, for instance, lats, they show shoulders, they show some different things, as far as putting on legs. And so, depending again on how you're trying to use this, but we're thinking about muscle recovery, essentially, and activation, as we talked about. So if I were to do that, I can talk about some of the ones that I like. And so going through this booklet, there's this one in here. I want to try to find the page for you. I'm just going to show you the arm one for now, because obviously it's not very exciting or sexy to watch somebody on an estim unit, which is part of the reason why a lot of clinics use them, I think, because it kind of frees up people's hands. But there's nothing really fun about it. Most people are probably on their cell phones half the time when they're doing this. I wanted to show this one they call the arm flesh. So it's probably going to be hard to see this, so I'm going to show you on myself. And basically they have one they call a global arm flesh, and they have one they call a mid-arm. I'm going to show this mid-arm one here, just to kind of give you guys an idea. And so what they do is they basically put one of these pads, kind of right in here, just kind of general vicinity between bicep and tricep. And they put this one over here, kind of in this inner forearm region here, okay? And so that looks pretty similar to what this guy has. Actually, theirs might be up a little bit higher. Maybe they're trying to get into this brachioradialis muscle a little bit here. And that's pretty much where this guy has the pads. And so from there, all you're going to do is take this end, which is your loose end. You're going to plug these things in. This is the part where it gets a little tricky to do on your own. But once you've done it a couple of times, you get pretty good at it. Hopefully it shouldn't take you too long. Okay, so those guys are in place. All right. I'm plugged into A here, so I'm going to use A for this thing. So I would turn it to A. So I'm turning it on now. It says basically intensity. And so I'm going to start turning this thing up. Personal preference comes into play here quite a bit. You're going to feel just a little bit of, you start to feel a little bit, I can actually see just a little twitching here. I don't know if you're able to see that. Sometimes you can play around with the pad placement depending on if you want a strong contraction or not. At a certain point, it can become uncomfortable sometimes. And so sometimes, depending on if you're on a motor unit or not, you may not like the way it feels. If it feels kind of sharp and it stings, I would probably try to move it. So this is obviously doing a pretty good job down here. I'm not getting the same kind of contraction there. So again, I could just put this off to the side, for instance, and I can decide if I like the way that felt. So here you can see I'm getting a pretty good contraction now, okay? So I definitely know I'm getting a good muscle contraction. Now, the thing is, in this case, because I'm probably pretty close to a motor unit, if I'm getting this much of a contraction, it's hard for me to think that this wouldn't be at least maybe a little bit fatiguing. So what I would probably do in my case is I might move this thing down maybe a little bit, so that kind of matches more what I'm feeling here. And so I would go ahead and turn this thing on again. I'm going to go up to the same level. Okay, now I'm getting kind of that sharp feeling that I don't like, where I think I'm actually more, maybe a little bit closer to a nerve there. Okay, let's turn this thing on again. It's okay if I get a little contraction, but I'd like it to feel a little more evenly matched in these two things. Okay, so there we go. So now I feel a little bit of a contraction. Not too bad. Okay, so that feels a little more evenly matched. And again, you can decide how high you want to turn this thing up. I would say it's not one of those more is better things. This shouldn't feel like some interrogation session at Guantanamo. I would say most of the time with these, I would be going for probably a lower level activation. And you can kind of experiment with the variables. Now, in the study that was done, which is the main study that MARC Pro uses, that's sort of their claim to fame, is a study which was a small sample size. I think they did one study with 14 participants, another one had 13. One of them looked at, essentially quad activation on a Nautilus leg extension. Another one was on hiking, where they had, I guess, a downhill and an uphill, again, trying to go for some degree of quad fatigue. And essentially what they found was they put this thing on one leg for an hour, immediately after the, I think, isometric, or not isometric, isotonic. It was basically a 10 rep max leg extension. They only, flushed essentially the right leg. So they did their 10 rep, essentially exercise. Then they went ahead and they put this thing on for an hour. And then they asked them subjectively, how fatigued do you feel, in one leg versus another? And then they had them do another exercise on each leg to see if it was different. And lo and behold, the right leg was a little bit stronger. Now, there was no control group, and that's really a huge problem with this study. So obviously you can't really blind people in this setting. So just because you didn't do the left leg doesn't mean that, the person doesn't know that, okay, this device is supposed to be doing something for me. And if any of you are familiar with Ellen Langer's work, she wrote that book, The Mindful Body. Our perception definitely can influence a lot of, essentially our fatigue. She likes to cite this jumping jack study where, whether you tell people to do 100 jumping jacks or 200, they both, both groups get tired around 2/3 of the way through. And so it really just shows that it's our perception of what that limiter is that influences where our fatigue kicks in. So it's no surprise that, if I was getting stimulation on one leg, I didn't get it on the other, I'd have some sort of a perceived benefit of, okay, my leg's probably supposed to feel a little better on the right side. And then lo and behold, it did. So I really wouldn't take that study to the bank at all. Very small sample size, and you really need a different group. You need a person that you're essentially not doing this to at all, and then a person who you're doing this to, and then you need to compare those groups, and then you need to be blinded. So I would say that study leaves a lot to be desired. So whether you're going to hang your hat up on their findings, I'd say maybe not. I wasn't really able to find a lot of other good research from them. I don't know if there's another study that's out there. If there is, certainly point me out to it, and if you could put it in the comments below, I'd be happy to take a look at it. All that being said, there was a benefit, and it was a somewhat significant benefit within the groups that they tested. And so again, those caveats being a very small sample size, and it really was not blinded. So having said all that, I would say that this device, I wouldn't probably try to go for an hour per se. You could if you want to use their protocol. If it's low enough that you can kind of distract yourself, you can be watching television, doing something else, you want to do it for an hour, you certainly could. And what you can probably do is play around with, okay, a little bit lower intensity versus longer time. I would think that probably in theory would be more beneficial than doing this thing for a more intense session for shorter. But if that's all you have, so again, I only have 10 or 15 minutes to plug this thing on, and I need to do it a little bit more intensely to kind of get more of that flushing, you can experiment with that as well. Take a little trial and error on your part. But if you're willing to go through that process, I think that's where you might be able to hone in on kind of what the most beneficial parameters for you is. And hopefully at some point, if more studies are done, they can kind of elucidate what was the best parameters among different groups, but we just don't know that yet. So at this phase of the game, it does take a little trial and error. Personally, in my own experience and how I would use this thing, I would probably do it somewhere in the maybe 15 to 30 minute mark. And what you might notice is sometimes at a certain point, your body kind of gets habituated to this a bit. So initially you might be getting a little bit of a stimulation, and then eventually you don't really feel like there's much going on. And so as you're going, then eventually you might need to turn it up a little bit. And so if that's the case, it ends up being a little bit dynamic because you're not just staying at one setting, you're kind of modifying the intensity as you go. And I would just probably try to go for, again, a lower level of muscle activation for a little bit longer time if I could. It might be hard if I'm, doing keyboarding when I've got my arm kind of like twitching a little bit here. So it really depends on what you're doing. Watching television, obviously, is a great one. Perhaps reading, things of that nature. You can kind of just, be on the cell phone, taking a call, and you don't necessarily need to set aside any specific thing for this. On the other hand, if you're kind of moving about, driving, I wouldn't necessarily recommend plugging this thing in. The other caveats always with electrical stimulation, there are some contraindications, pregnancy, skin issues, different things of that nature. So obviously, you want to make sure you're cleared. You don't want to put this thing directly on your chest, the vicinity of your heart. Certainly if you have a pacemaker, metal implants, you also want to be careful. Anybody who's had a shoulder replacement, you'd want to be careful doing this because maybe that stem is going down here. Metal obviously can get hot when it's being stimulated, and so that's a contraindication there. So you can definitely look up what the contraindications for electrical stimulation are. I'll try to post some at the bottom of this video, and we want to make sure you don't necessarily fit into those categories. And if you do fit into those categories, I would certainly talk to a healthcare professional about whether or not this thing is going to be a good idea for you first. In this MARC Pro device, they also have all the disclaimers. So that being said, if you don't fit any of those disclaimers and you want to try this thing out, I would say that it is an expense though. So you really also have to weigh that against the background. So most of these units, again, they had some Black Friday sales and different things, but a lot of times, they were between like $600 and $900. And so if that's the case, you want to make sure that you're going to actually be using this thing on a regular basis. And you're going to make sure that you really are doing all the other things first that you should know, you should be doing. So, if you're not sleeping that well, if you're not really doing your workouts very consistently, if you're not eating that well, those are basically like the three horsemen right there. I mean, those are the things that I think are really going to be your foundation, most bang for your buck. And a lot of other things are going to be icing on the cake. So I would say make sure those three things are really in place. Once you really feel like you're exhausting everything, you're doing all that, maybe you're even doing good soft tissue work in addition, whether it's massage or foam rolling, so you're ironing all that stuff out, and then you still want that little extra edge. That's where I think this thing can possibly come into play. In certain rehab scenarios too, I think this might come into play. If I had somebody pretty low level, or again, somebody I'm looking at that maybe I don't want to induce any more muscle fatigue or muscle damage, or maybe I'm trying to help somebody through some muscle soreness so I can get them back, say, into the rehab gym more quickly to try to really, get them to progress. That's where I might try to, give this thing a shot. If I'm just taking a weekend warrior who's coming in and, they want to get stronger, they want to get more fit, this is going to be pretty low on my totem pole of what I want to do with somebody, a given individual. And for that reason, that's part of the reason why I think electrical stimulation I haven't really used a lot in general. So, NMES and Russian, there's different, currents that essentially can be used with normal EMS units. And I just found they never really gave me a lot of bang for my buck. So, a lot of times, physical therapy outpatient offices are very busy. And so it's just a way to kind of untie your hands a little bit, So if I have somebody and I'm supervising an assistant and an aide, and I've got, 3 patients waiting on me, I don't want to necessarily, have to devote one-on-one time to everybody. So if I can throw somebody on a stimulation machine, or have the aide do some ultrasound, all those modalities, cryotherapy, that have been overutilized in outpatient therapy clinics for a long time, it's basically just a way to stay busy. And, to their credit, the reimbursements are not that good. And so the impetus is for them to be very busy because they're not getting paid a lot. Obviously, the demand is very high as well. So, there's a few things at play that can kind of explain that. Overall, though, if I had somebody that I'm really trying to be optimal with, I'm probably not going to be spending a lot of time with estim in general. Again, this unit might be a little bit unique, and I would say that it's still going to kind of fall into that icing on the cake category, at least for me. Once again, I'm sure that I've checked all the other boxes off the list. Things are going well in those departments. I want to give somebody that edge. I want to give somebody a little bit faster, perhaps, recovery. I would certainly experiment with this, and especially if I had it. So if this thing's already laying around, then sure, use it. Would I tell somebody that, to go out and buy this thing? That would be kind of a case-by-case conversation. If I had somebody who's pretty affluent, they could afford it, and they didn't really, bat an eye if it didn't go so well, then I'd say, okay, maybe give this thing a try. On the other hand, if it was somebody where this is going to be a significant expense for them, I'd probably say, let's do some other things first. Let's see where that gets you. So all that being said, that's the MARC Pro in a nutshell. I hope you guys enjoyed this video. It wasn't too boring. Again, I know there's nothing sexy and really about watching somebody on an estim unit, but I do think recovery is a very important aspect of training, because you can only get as strong as the workouts you can recover from. And so anything we can do to try to either mitigate or fend off some of the soreness, get back to the gym quicker. Certainly, if there's anything that we can do to facilitate tissue healing and recovery, get back to the gym quicker, that's all going to be very valuable. And I think there may be a little bit of ability for this thing to do it. So again, if this sounds like something for you, could be a good stocking stuffer, I suppose, although this might be a little big for a stocking, possibly a little expensive too. But you can give it a try. I'm not necessarily affiliated in any way with MARC Pro, by the way, so I'm giving you my 2 cents. One thing I should say about that study, though, the study that I looked at, there was a bit of a conflict of interest because many people on the board of MARC Pro were behind that study. So again, that's another caveat you can also take in addition to all the other issues. But what I would love for them to do is hopefully, let's see if they can get behind some other studies. Let's really see what this thing can do. In the meantime, I guess we're kind of left to experiment with it on our own devices. That being said, I do know there are a lot of somewhat prominent people in the field who are using it, strength coach-wise and such. You can go on the internet and you can check out who's using it. So certainly comment below. Let me know what you guys think. If you guys tried this or other estim units, what your 2 cents on all that stuff is. And if you want to see anything else on this channel, probably my last video of the year. But I will try to come at you with some good content in 2024. Hopefully get a video up sometime in maybe, first, second week of January if I can. And I still need to talk about, and I've mentioned this in many videos, BFR. So I want to get into blood flow restriction training. That's a very good topic. I think that actually is something I do think can move the needle for some people. So stay tuned. Wish you guys all the best. Happy holidays. Happy New Year. From Exercise Lab, let's make 2024 a good one. I hope you guys have some fun.